Our Jillian Piper joins us now from Ottawa with the details. Jillian.
Jeff, an individual in Ontario who recently traveled to East Africa is now being tested for Ebola and other infectious diseases, according to the provincial government. The virus is primarily spreading in the Democratic Republic of the Congo, leading to a public health emergency. I'm afraid of bringing the disease home to my family, this man says. I'm afraid of dying. If the test in Ontario is positive, that would be Canada's first confirmed case of the virus, which has a 50% fatality rate. There are now more than 600 suspected cases and 139 deaths in the DRC and neighboring Uganda, and the World Health Organization expects those numbers to get even worse.
There are several factors that warrant serious concern about the potential for further spread and further deaths.
The deadly outbreak comes just weeks before the DRC's national soccer team is scheduled to play their first World Cup game in Houston, but their fans are unlikely to join them. The Trump administration is barring anyone in the DRC, Uganda, and South Sudan without an American passport from entering the U.S. for 30 days.
It's been confined right now to Africa, but it's something that has had a breakout.
Canada currently has no plans to implement a travel ban.
We are very closely monitoring the spread of the Ebola virus.
The virus is transmitted through direct contact with bodily fluids, which this doctor says reduces the likelihood of transmission compared to airborne viruses.
We've seen measles imported to Canada and other infectious diseases, but I think the risk of Ebola would be extraordinarily small, but of course not 0%.
The World Health Organization says the virus is a public health emergency with international concerns, but it has not identified the outbreak as a pandemic. Jeff?
Jillian Piper in Ottawa. Thanks, Jillian.